Ladies and gentlemen, welcome to the annual shareholder meeting of Mizer Pharmaceuticals. It's my pleasure to show you a preview of the commercial for our new drug, Excellent. When the patent runs out on our older drug, Excel, any company can make a cheap generic version. This new formulation will be ours alone for 20 years. And we'll charge even more than we did for the old one. Our marketing campaign kicks off with a press conference this afternoon.
Excellent, I'm what you want. You don't know, but you need me for success, beauty, prowess. You'll be happy to eat me. Mountains of dough, may they grow and grow, grow and grow forever. Excellent is what you want till we say something is better. Excellent, I'm what you want. You don't know, but you need me for success, beauty, prowess. You'll be happy to eat me.
The most common side effect is dry mouth. Others include constipation and problems passing urine. If you have vision changes or eye pain, your breathing suddenly worsens, you get hives, or your throat or tongue swells, stop taking and contact your doctor.
Excellent is what you'll want till we say something is better.
What do you think? Makes you want to try some, doesn't it? Have some samples. If your tongue starts to swell up, there's a water fountain right down the hall. I call this press conference to announce that our new drug Excellent was approved by the FDA and will soon be available in pharmacies. This wonderful new drug represents a major therapeutic advance and is an example of our company's mission to advance medical science and provide the best care for patients.
Reporter Rawl from the Chronicle. 4 out of 5 new drugs are really Me Too versions of ones already on the market. Isn't Excellent basically the same as Excel?
The FDA has recognized Excellent as an entirely new therapeutic agent.
But sir, is there any evidence that it works better than the lower-cost generics?
Well, those studies have never been done, and we certainly aren't going to pay for them.
And didn't post-marketing studies show that some patients taking Excel had serious side effects, even death?
Now, that data was never published, so it's almost like it didn't even happen.
After our latest merger, we now control 80% of the market. However little we want to pay, those doctors and hospitals have to sign our contract because we've got all the patients. Oh, it makes me so happy. I've just got to let out a good howl.
We don't pay for birth control, just for erections. You're cancelled, you didn't say you'd had yeast infections. We put you on hold when the telephone rings. These are a few of my favorite things. When the dog bites, when the bee stings, when you're feeling bad. I simply remember my favorite things, and you have to pay the tab. Co-pays, deductibles, authorizations, out-of-plan rates if you're sick on vacations. Yes, they did ask and we did say okay, but we've changed our mind and we're not going to pay. Bronchitis, appendicitis, If you're looking ill, I simply remember my favorite things, and you have to pay the bill. Ambulance coverage out of the question. That terrible chest pain was just indigestion. We took that drug off our list last week, dear, but you can't change plans for a whole nother year. If you stumble, take a tumble, need to have a stitch, I simply remember my favorite things, and that's why we're so rich. Money, 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 money.
Well, I'm off to deposit my paycheck at the bank. Well, maybe I'll just stick it under my mattress, or maybe I'll use it as a mattress. Money, 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 oh, I love it, I love it.
Doctor, I want a prescription for Excellent. I saw an ad on TV and I've got the same symptoms. Feeling tired, low energy. My brother-in-law, he took Excellent and it fixed him right up.
But Bob, those are very common symptoms, which we all get from time to time. That medicine is for people who have anemia from cancer treatment. You never had cancer, and you don't have anemia either.
Well, I just know that it's the right medicine for me.
Oh dear, we spend so long talking about Excellent, your appointment's over. And I didn't even get to talk to you about getting a tetanus shot or screening for colon cancer. There's never enough time. Did you know for a family doctor to give all recommended preventive care would take 7.5 hours a day? And that doesn't even count taking care of sick people. Now I've got to go see the other patients who are waiting. Oh, you're doing so much better now that you're back on those inhalers.
Now I can even breathe when Grace makes us run, and I can sleep all night without wheezing.
You've helped our family so much. I've been thinking that maybe I could become a doctor and help people too.
I don't know, Lisa. It is good to help people, but medicine today isn't what it used to be. With so many different health insurances, there are 3 billing clerks for every doctor, and the average family doctor spends half a day a week just filling out forms for insurance companies. For all that, what we get paid is barely enough to cover the cost of running the office. Insurance companies are out for short-term profit and pay doctors the least they could get away with. Between the hard work and the low pay, fewer medical students are choosing to be primary care doctors, and many of the ones we have are retiring, just as the aging baby boomers need more care. I don't know who will take care of me when I get old.